I'm Laval Miller-Wilson. I have the privilege of being the executive director of the Pennsylvania Health Law Project. Medicare is the federal health insurance program. It covers people that are 65 and older. It also covers people that have permanent disabilities. Before Medicare began in 1965, half of seniors didn't have health insurance. Today, virtually all seniors, 65 and older, have Medicare. You have in Pennsylvania 400,000 out of the 2 million that are enrolled in Medicare are persons with disabilities, severe disabilities, such that they're receiving Social Security income, disability income. You have the 4 parts of Medicare, Part A, Part B, C, D, and together these 4 parts provide basic medical coverage. Part A covers hospital coverage. It's really as simple as that, and at times hospital coverage can be the most expensive. So for that reason, there's no premium that's associated with Part A coverage. Part B coverage provides what we call outpatient, so physician's visits where you're not being checked into the hospital. And there is a premium contribution. Those are what's part of original Medicare. And then when we had, in the last decade, 2 major components that were added on to Medicare. Part C doesn't necessarily have a benefit the way that A and B does. Part C is a packaging of all of those different components into a private insurance plan. Instead of having the federal government do a fee-for-service where it's paying directly the provider, Part C allows Medicare beneficiaries to enroll in a private insurance program, a managed care plan. And then that managed care plan provides a network to provide the hospital, the provider, the drug package. And then in addition, some Medicare Advantage programs distinguish themselves by selling some additional benefits, vision, dental, which are not covered under Part B or Part A. You don't have to go into a Medicare Advantage program. Part C is optional, and Part D is the prescription drug benefit.
Part D covers what's known as the donut hole.
The donut hole is a coverage gap program for those that are in Medicare D for the drug benefit. When you get Medicare drug coverage, it's a shared program, and you pay some of the costs, and then Medicare pays some of the costs. Once you and your plan has spent that amount, then there's a greater share that's put on you and not covered by the federal government, up to a certain limit. That's the coverage gap. That's the donut hole. If you're 65 and older and you're receiving Social Security, you will automatically be enrolled in Medicare. If you're 65 and want to continue to work, that's fine too. You can opt not to take Medicare. And if you have if you're working and that employer provides your health coverage, that will continue to be your primary payer until your retirement, and then Medicare becomes the primary payer. So in terms of enrolling and you're working at 65 and you're receiving health insurance through your employer, for the most part, folks don't need to do very much. It requires an affirmative step for a person with disability to apply for Social Security benefits. And upon receipt, after receiving funding for 24 months, then Medicare kicks in, so to speak. So that's it in terms of enrollment.
Miller-Wilson says even with the introduction of the Affordable Care Act, Medicare remains largely unchanged.
The Affordable Care Act doesn't take away any of the guaranteed benefits that I described before. The Affordable Care Act doesn't take away Part A, Part B, Part D, or Part C. What it has done is it's said for some of the payments that are required from Medicare beneficiaries, we don't want you to pay for preventive visits any longer.
Miller-Wilson says the Affordable Care Act is also designed to help close the donut hole in prescription drug coverage.
The percentage for the prescription drugs is picked up more by the federal government. Beyond that, the Medicare programs just simply hasn't changed in comparison to some other programs.